Here. Hi,
Hi,
Zach.
everyone. If you are a therapist, you're in the right place. In the next 20 or 30 minutes or so, we're going to learn all about imposterism, formerly known as imposter syndrome, what it is, what are the 5 subtypes of imposterism, which is super important to know as clinicians if we're going to work with this, and how to help people who have a lot of self-doubt. So buckle up. Here we are. I'm Zach Taylor, Director of Psychotherapy Networker, a nonprofit dedicated to telling the stories of psychotherapists and bringing you great education like this. And I'm here with Dr. Jill Stoddard, who is the author of the brand new book, Imposter No More, on overcoming self-doubt. Oh, and there it is right there.
There it is.
Jill is going to be actually this week one of our esteemed faculty members at the Innovations in Psychotherapy Conference in Anaheim, California. If you'd like to join, there's still a few seats left in Anaheim if you're not too far, if you want to hop on a flight, or you can join online. Either way, it's going to be one of the coolest West Coast psychotherapy conferences of all time. It should be pretty exciting. If you'd like to see the full lineup of who's going to be there, check it out. Last, before Jill gets started, Jill has developed a really interesting imposterism quiz to let you know which of the 5 subtypes you may be dealing with. And if you'd like to take that quiz, it's free, right, Jill?
Absolutely.
It is free. And Cole just put that in the chat wherever you're watching right now. It is in the chat. And you can take that quiz. We're going to talk about the 5 subtypes here. So let's dive in. But if you have feedback or questions for Jill, please definitely drop them in the chat as a comment wherever you're watching. So Jill, a lot of people are talking about imposterism. We've all heard the phrase imposter syndrome. And you admit this is an emerging area of clinical study. It's kind of something we're still trying to figure out. But you're a big proponent that this is not really a pathology per se. Say more about that.
Yeah, absolutely. So this was really emerging in terms of it's gotten popular lately, but it was identified by 2 psychologists back in the late 70s, Pauline Clance and Suzanne Imes. And at that time, they called this the imposter phenomenon. And they thought that it really only affected high achieving women. And, given the time, late 70s, early 80s, I don't think it's a coincidence that when women who are successful were experiencing self doubt, our culture suddenly decided it was a syndrome, a disease, or a disorder or pathology. And, so to me, this is an issue of sexism, is where it started to be called a syndrome. It's not in the DSM. It is something that now the prevalence rates vary widely when you look at the research, anywhere from 9% up to 86 or 87%. Most of the studies I've seen range about 40 to 70%. So really that's like most of us will experience this at some point in our lives. And if that's the case, it absolutely cannot be a disease or a disorder or a pathology. It is not a syndrome. And it also seems to be the case, possibly, this is an empirical question that hasn't been really thoroughly answered yet, but it appears to be the case that people who have had experiences with marginalization also may be more vulnerable to developing this, right? When you've been told you don't belong at certain tables, then you may question whether you belong at certain tables. So again, not a syndrome, right? A phenomenon, an experience,
Mhm.
something like that.
When I heard you say that for the first time, it changed what I thought about this. It normalized the experience for me. It sounds like it normalizes it, as you're saying, for women and for other marginalized groups. So I think we can just put on the table 40 to 70% of us will experience the sense that we don't belong. We're an imposter. We shouldn't have what we have. We just don't we're not like other people. We're a fraud. So this is something likely we're going to experience and see in our practices.
Mhm.
What kinds of things would we hear our clients saying? What kinds of things would they be doing if this is something they may be struggling with and might become a focus of our clinical work?
Yeah, I think that's a great question because I rarely have someone come to me saying, I'm here for therapy because I have imposter syndrome. Usually, I mean, I run an anxiety clinic, so everybody who comes to me is coming because they specifically have something going on in the world of anxiety. But then it becomes pretty clear that this is part of that picture when I hear a couple different things. One is if I hear that there are, goals or dreams or aspirations that people want to be moving toward, typically professionally, but it could be in other areas as well, where they're expressing a lot of that inner critic is really loud. They're expressing self doubt, uncertainty, lots of social comparison. But the other, and that's getting in their way, where they're not moving forward with those things because the self doubt is getting in the way. But I often hear the exact opposite of that. And these are the people coming to therapy because of burnout, because they're on that hamster wheel of achievement, right? Like, I just have to do one more thing, win one more award, get one more promotion, and then maybe I'll finally feel like I'm enough, I'm adequate, I've proven that I'm not a fraud. So we see
Hmm.
we see sort of both of those things.
That's I've never heard anybody kind of put this in with burnout. But if we have clients coming in who are experiencing this kind of burnout from just not being able to stop or slow down, um, we might want to keep this in the back of our minds. That's great.
Yeah.
I think the coolest thing that you've done with this is create this imposterism quiz. It's based on someone else's work, of course, and you're very open about that. But you looked at this probably more than anyone, and really popularized these 5 subtypes of imposterism. And I think for me, that took this concept of imposterism, and I wanted to understand it, but I never could. And it really gave it legs. It really gave it
Mhm.
something I could hold on to. So the 5 types that you've popularized really are the perfectionist, the superhuman, the soloist, the natural genius, and the expert. I don't know if we have time to go over all 5, but if you could just tell us a little bit about those 5 subtypes and why they're important to understand as
Sure.
clinicians.
Yeah. So this is from the work of Valerie Young, who's another psychologist who also she wrote a book also about imposterism that's a few years old that's specifically for women. Um, And so the expert, I can start with the expert because that's me. And when I talk to other people in our field, this is one that I hear very commonly, as well as the perfectionist and the superhuman. And so basically, what these subtypes are, we're shorthanding it by saying they're subtypes of imposter, but really what they are is it's ways that we try to prove our competence to avoid being outed as a fraud. So, for example, the perfectionist, I guess, is kind of the obvious one. You have very high standards. You try to do everything at the absolute highest level. But if there is a mistake or if those standards slide, that then becomes, quote unquote, proof that you're actually incompetent or you're a fraud. For the expert, which is me and the one I see a lot of mental health professionals, it's I have to take one more class, listen to one more podcast, read one more book, get one more certification. It's that constant need for knowledge, expertise, skill in order to feel competent. But the problem is, I always get this image of a cup where we're pouring water but there's a hole in the bottom and it never gets topped off. That
Hmm.
that there's never quite enough knowledge that you finally feel like, okay, now I am expert enough to move forward with whatever it is I want to do. And
Mhm.
the superhuman is kind of a combination of some of these, which is I should be able to juggle every single ball on fire while on a unicycle, smiling and unruffled. And of course,
Mhm.
eventually one of these balls will fall. And that is proof to the superhuman that they're not competent or they're a fraud. And in their mind, they should be able to, spin plates on their nose while they're doing
Mhm.
all of these different things.
What about the soloist, the 3rd type?
Yeah. So the soloist is the person who believes achievement only counts if you do it alone. So if you have to ask for help or you need assistance in any way, this is sort of proving again that you're not competent, that you're a fraud. And then the natural genius is the person who thinks like you either have it or you don't. It's kind of like Carol Dweck's fixed mindset versus growth mindset,
Mhm.
that intelligence is innate, that you should be able to just pick things up quickly without much effort. And if you're unable to do that, then this is evidence that you're incompetent and you'll be revealed as a fraud.
I think that's so interesting. So you did a little reframe there that these aren't just subtypes of imposterism, but these five types are actually the five ways we try to sort of prove that we're not a fraud when deep down we feel like we probably are. Um, that's fascinating. You know, I took your quiz and I tied I tied for the perfectionist and the superhuman.
I would have
So
guessed that. I would
would
have guessed
you?
superhuman for you, Zach. Yes.
Yeah. Um, you know, yeah, that's oh, the beating myself up. Just ask my wife. Don't ask my wife, actually. Um, but you know, at a lower stakes level, I actually experienced this around playing the guitar. I love playing the guitar, and I've interestingly enough always held myself back because I'm like, I'm never gonna be as good as so and so. So just don't even try. Don't even bring your guitar places. And that's held me back quite a bit. And so maybe I'll
Yeah.
take a different approach.
It's a perfect example of
Yeah,
how those subtypes play out. If I can't do it perfectly, I might as
yeah,
well not do it at all because I don't want to face
yeah,
that I'm not as good as I'd like to be.
yeah.
Yeah.
If you're watching this, you'd like to take Jill's imposterism quiz. It's free and really interesting. I know
And
it's in
I
the
can
chat,
I
and you
add
may
to
feel
that
free.
that
Yeah.
like people will often see themselves in more than one,
Yes.
right? Like, oh, I think I might be the perfectionist and the natural genius. And that the quiz does give you percentages. So, like you said, you had two that tied.
Yeah.
So you can sort of see to what extent you're in
Yeah.
each of them, right? Yeah.
Yeah. It's such an interesting Clint, in fact, we had a comment earlier about how this isn't in the DSM. We probably shouldn't focus on it. Maybe you know a lot of the issues that we see, especially today, as we take on as therapists more and more and more. Um, this is an important concept that is a real experience in people's lives, and so I'm so glad you're bringing it up. You're recognizing it, whether you call it imposterism or not. The fact is, a lot of our clients come in experiencing extreme self doubt
Yes.
and I love, Jill, that you say this is pretty normal. It's natural. It's healthy. Up to 70 or 80% of us experience it at some time in our life. That's a huge weight off of my shoulders. So maybe we're just all imposters like everybody else. The other interesting thing about what you do is that you don't take a standard CBT approach to this, which is you feel like a fraud. Let's get rid of those thoughts. Let's have different thoughts. Your approach is based on ACT and psychological flexibility. Talk a little bit about how you work with imposterism and self doubt from that perspective.
Yeah, so for me, and I live this in my own life, and it has been helpful for me. I was trained in a traditional CBT model, and then also trained in an acceptance and commitment therapy model. And what I realized is that cognitive restructuring works great in certain contexts, right? So, like if I'm driving in traffic and I'm getting all upset and thinking I'm going to be late, and this sucks, and don't these people have jobs? Why is everybody on the road? I can take that thought and go, okay, hold on a second here, Jill. It's just traffic. You'll get there when you get there. Getting upset isn't going to make the cars move any faster. And I can change my perspective, and that will help me sort of soothe my nervous system. And there's nothing wrong with that, right? Like trying to feel better. And it might even make me drive more safely, where I'm not going to honk and flip people off and swerve through traffic, right? But it seems to be the case when we try to apply those very same strategies to thoughts like, I'm not good enough, I'm inadequate, I'm a fraud, everyone's going to figure out I don't really belong here. Our brain does this funny thing where if you try to convince yourself that's wrong, right? So, like, Zach, if you told me you were having these issues and then I had your CV in front of me, and I said, Zach, how can you say you're inadequate or mediocre or not special? Let me read off all the incredible things that you've done. And everyone who's watching us right now would go, yeah, Zach, Jill's right. You're amazing. Your brain is going to go, yeah, but, and it's going to supply all sorts of data to the contrary. And this is what brains do, it's trying to protect you from humiliation, failure, rejection. And we just don't take that data in and go, huh, yeah, the data supports that I'm not a fraud and I am adequate. So now I'm going to go do all the things. Like it just doesn't seem to work that way. So, what psychological flexibility allows us to do instead for those thoughts that aren't so amenable to change is instead of changing the thought, we can change our relationship to it. So, there are strategies we can use to become good observers of our thoughts, to sort of detach and look at them. Some people will say instead of looking from our thoughts, which is what we normally do, we can kind of put them out here and look at them. Um, and then with the feelings, the anxiety, the self doubt, we can learn to practice willingness to make space for those feelings. So we're not struggling to change or get rid of anything. Instead, we're learning how to let whatever is already here anyway
Mhm.
just be present and to not dictate what we do or don't do. The way we choose that is based on our values. So, who we want to be, what we want to stand for, what we want our lives to look like,
Mhm.
and to make conscious, deliberate, mindful choices about moving toward values rather than being sort of bullied by our thoughts
Mhm.
and feelings.
One of the I've got to read this because one of the lines you that sticks in my head, rent free. So they
Mhm.
say the paradox is that we worry about the things that we value. We worry about the things that we value. So that if we're worried we're not doing good enough, that we're not enough, that we're not making it, uh, it usually means we're actually in the activity of doing something we really care about. Can you
Mhm.
unpack that a little bit?
Yeah, absolutely. This is one of those things that once you hear it, you're like, oh, yeah, that makes sense. But so Steve Hayes, who's the founder of acceptance and commitment therapy, at some point along the line, he said the words, we hurt where we care. And it was like the minute I heard it, I just went, oh my gosh, yes, of course. So, if you put your hand on a hot stove and feel pain, you take your hand away and avoid a serious burn. And then we kind of apply that same logic to our emotional pain as well, except that often if we're anxious or having difficult emotional experiences, really it's a sign that we're exactly where we need to be because it hurts because we care. So I always give the example. Think about what you or your clients lay awake at night worrying about, right? If you're up at 2 a.m. and the wheels are spinning, you're the example I love to give is you're probably not fretting about the fact that there's not going to be a season 4 of Ted Lasso, even if that was your absolute favorite show ever, like it was mine.
Mhm,
You're worrying about the stuff that deeply matters to you, the person, your relationships, your career, your family,
mhm,
whatever the case may be. And that this is really this sign that, like, maybe instead of sometimes feeling fear means we're in danger and we need to fight or flee. But
mhm.
lots of times it's a false alarm. And really, it's a sign that we need to be leaning in and looking at what this pain can tell us about what matters to us about our
Yeah,
values.
right. Um, Rebecca wrote in from LinkedIn, I'm mentally ill, and all of a sudden I have the first career of my life, and I feel like
Mhm.
such an imposter.
Oh, I just got goosebumps. Oh,
Yeah,
it's so relatable. Yeah.
right. Um, well, again, if you'd like to hear more about Jill, you're welcome to take the quiz that she's got on her site. It's totally free. You're welcome to check out her book. It's brand new. It just came out, called Imposter No More. Really good. Just read it this weekend. And if you're up for it and you'd like to see Jill do a workshop, she's going to be on our faculty for the Innovations in Psychotherapy Conference, a huge conference. There'll be, I think, over 35 or 37 um, expert trainers doing workshops over 4 days. And our keynote's actually Ashley Judd and David Kessler, the actress and activist Ashley Judd. So, Jill, thank you so much for being here today. I want to ask you just one last question. Is there anything else that you would like to leave with your colleagues here before we go that we might have missed? Something we need to think about a little differently, something we need to re-examine? Um, what would you leave with them?
Well, I was asked to give a talk to a bunch of teens and to like give them something they'd walk away with that would change their life is about mental health and suicide. But I only had 15 minutes or 20 minutes. And I was like, oh, no pressure. But I really thought about it and I thought, truly, if there was one thing that I could teach people, all of us as colleagues in our professional lives, as well as for our clients, if there's one thing that I think could be truly life altering that is part of psychological flexibility, it's learning how to get better at being comfortable, being comfortable being uncomfortable, getting comfortable being uncomfortable, at least willing to be uncomfortable. Because when you think about how many choices you make out of a desire to avoid discomfort, it really has an impact on how sort of big or small your life is and how much you're able to really live your values. So that's what I would really encourage people to do. And I have lots of practices in the book that are ways that you can kind of train to like strengthen those willingness muscles. But that would be my nugget that I would want people to really work on for themselves and for their clients.
Thank you. Well, everyone, thanks for joining us. We do these networker lives every now and again, so follow us on social and keep an eye on our page. This will replay on our page as well as our YouTube channel for you to go back and rewatch anytime. Jill, thank you so much for taking time to be with us at Psychotherapy Networker. Thank you all. We love what we do. We love our colleagues out there, and we think Psychotherapy Networker is this really cool nonprofit organization that represents all of us psychotherapists, regardless of our license, regardless of our approach. It's a place we can really come to the table, come together, and be therapists together. So thank you again, Jill, so much, and thank you all out there for watching.